Hey, buddy.
So as zoo vets, our primary role here is to look after the health and well-being of our animals. So we work with the keepers constantly to make sure that our animals have a really high level of welfare. The species we have are advocates for their wild counterparts, but actually most of the species that we look after have lived much longer than animals do in the wild. So we're doing regular vet checks on the 2 seals that we've got. The reason we do that is because they've getting a little bit older in age and they've got some long-term issues that we're monitoring to make sure that they're not affecting their overall quality of life. This front left flipper here is the one that was hit by a boat as a pup, and that's why he came in. He's got permanent damage to that limb, but he seems to cope really well. He also, shortly after he arrived, he developed this severe left eye injury.
For us, we've had to make quite a few changes in terms of how we work with them, and that's about changing those visual cues to verbal or physical cues. Luckily for us, he's a real smart cookie, and so he's actually doing really well. And when we do like to change the environment, instead of it being a surprise to him now, we like to take him around and show him, and that helps him gain a bit of a better perspective as he's moving around and keeps him safer as well.
One of the problems in zoo and wild animals is that they can hide the fact that they're unwell. So if they've just got a little bit of a sore knee, they don't always show that very obviously. So this is where the skill of the keepers comes into play. They know their animals intimately and they can try and detect those signs as early as possible.
Hey, so this is Herod. This is our male Tasmanian devil here we have at Auckland Zoo. And he is 6 years old, so that's what we would consider a geriatric animal here at the zoo. Devils in the wild would live anywhere from sort of 5 to 6, and in captivity it can just be a little bit more. Herod, what's this? Hi. So it's kind of good to see him eat like this. It's just a good indicator that A, he's hungry, and that he's not lazy and he just runs off. So it's kind of good to give him a little bit of a play, a little bit of tug of war, and then he'll get it as a reward. So mainly it's just checking that your animal's normal. Is he doing what he normally does? Is he behaving like he normally is? Anything different, then obviously you want to look a little bit further, look a bit closer. That's why, especially with our older animals, we do take a lot of care and a lot of time just to take that closer look.
There's a number of diseases that become much more likely for older animals to suffer as they get into their later years. Sometimes in older zoo animals, in spite of all the ways we can observe them and the preventative health we provide, we still want to look a bit closer and evaluate their health with more diagnostics. And in many of our animals that does involve anaesthetising them.
So Malik is one of our geriatric tigers here at Auckland Zoo. She's currently 18 years old, so getting there on an old age for a cat, and we really need to monitor her because she is in captivity. We want to make sure that we're giving her the best welfare we possibly can. Do you want to do training? You can. Good. You're okay. Good girl. So our back of house area is designed for practicality. It does allow us to get nice and close to our cats, as well as having that protective barrier, because we have to be able to do these kind of old age health checks with the vets to make sure everything is working as we think it is. So to get her trained and injectable in the crush, it allows us to do more checkups and make sure she is nice and healthy. You ready? 1 ml of saline, injecting. Needles out. Good girl. Just so it imitates as if they were having a proper general anaesthetic, because on the day they are going to be injected with sometimes a couple of mils of some sedatives to get them to go to sleep nice and calmly.
She last had a health check 2 years ago and that was all good, so it may be in the coming months that we need to revisit that and re-x-ray all her joints and do a full health assessment and make sure she's continuing to be healthy in her old age. One of the hardest parts of our job is having to euthanize geriatric animals. These are animals that animal teams and sometimes even vets have looked after for years. And it might sound an odd statement, But actually we euthanize these animals because we care, and we as vets care deeply about our patients, and it is one of the harder parts of our job to deal with, but it's actually one of the most important jobs that we can do in an animal's life is choosing when to step in to prevent them suffering.